If you've been in therapy for years and you're still redlining every time you're triggered, it may not be because you aren't trying. It could be because traditional talk therapy often fails to address what I call the thalamic gap, which is the place where your past and your biology are actually stuck. So most traditional therapy focuses on the present moment, right? How do we cope with this week's crisis? But for BPD, coping isn't enough. If your therapist doesn't do a deep psychodynamic dive into your bio-historical audit, they're just putting a Band-Aid on a hardware glitch. They are treating the symptom while the origin is still running in the background. So you're not going to see the progress that you really want to see. So I wrote the inner protocol, INNER. And in that protocol, we look at the thalamus, the brain's relay station. So when you experience early invalidation or trauma, the thalamus can fail to timestamp those memories sometimes. So this means your brain can't tell the difference between a threat in 2006 and a conversation in 2026. Traditional therapy tries to talk to your adult brain, but your survival hardware is still living in the past. So the inner protocol is different because we start with the archaeology of the narrative. We don't just talk. We perform that bio-historical audit that I mentioned to decouple those somatic triggers from the old story. We use executive inhibition to stop the automatic blackout, giving your internal CEO, that prefrontal cortex I'm always talking about, the power to finally edit the software that trauma wrote for you. Stop settling for Band-Aids, guys. It's time for a full system restructure.